Well, good morning. It looks like we can get started as a subcommittee. This morning I have a few items that I want to announce as business items. I already made this announcement, but now that we formally have begun, I want to make it again, and that is that SB 622 optometry has been put over until next week. And so we will not be hearing that bill today. Also, file item number 11. Also, file items number 5, SB 465 Hill, and file item number 6, SB 466 Hill, have been pulled from today's agenda and will also be heard next week. We also have file item 18, SB 323 Hernandez, has been pulled also from today's agenda and will be granted its reconsideration next week. File item 17, SB 270 Mendoza, has been pulled from today's agenda as well. After working diligently with my committee staff and the opposition to SB 270, the author has decided to pull the bill from today's hearing. The opposition has committed to work with the author's office to craft a solution to the issues raised by this bill over the coming months. I believe this is an important issue and would like to see a resolution within the next year. So we'll be hearing that bill hopefully next year. Okay, with that, we'd like to invite Senator Hill to come forward. And looks like we have SB 396. Is that correct? The first bill you'd like to present?
That is the first one. Thank you, Madam Chair.
And this is file item number 3.
Madam Chair and members, SB 396 would allow an accredited outpatient setting or Medicare certified ambulatory surgical clinic to access reports from the medical board to ensure that a licensee of the board has not had their staff privileges revoked or restricted. It would also require peer review evaluations every 2 years for physicians and surgeons working in an accredited outpatient setting, and for the findings of the peer review to be reported to the governing body, which shall determine that the licensee is both qualified and appropriately credentialed. It would finally allow for unannounced inspections by the accreditation agency of an outpatient setting within a 60-day time frame. We have support both from the Medical Board of California and the ambulatory surgical clinics. Respectfully ask for an aye vote, members.
Thank you very much. Those in support.
Yeah. Good morning. Jennifer Smoes with the Medical Board of California. The board strongly supports SB 396. Existing law allows a physician who owns his or own outpatient setting to choose not to have peer review of his or her practice. The board believes that for consumer protection, physicians working in ambulatory surgery centers should be subjected to peer review evaluations. In addition, inspections currently performed by accreditation agencies for outpatient setting accreditation are announced. Allowing subsequent inspections to be unannounced will be in line with inspections on other types of ambulatory surgery centers. The board respectfully requests your aye vote. Thank you.
Thank you. In support.
Madam Chair, members, Bryce Doherty on behalf of the California Ambulatory Surgery Association. We're the association that represents over 300 statewide ASCs in the state. We specifically support the provision in the bill that allows them access to the 805 reports that the medical board has. If that facility is either accredited, Medicare certified, or licensed, we need those reports in order for the governing bodies to conduct the peer review and to make sure that those physicians that are being granted privileges in those facilities don't have those privileges or restrictions on their license, their ability to practice in other settings as well. So with that, we strongly urge your support. Thank you.
Thank you very much. Anyone else in support? Seeing none, any opposition or public comment? Seeing none, any questions from the committee? And we're still functioning as a subcommittee. I don't think we have a quorum quite yet. I don't see any questions. Thank you very much. We'll move the measure once we get our quorum. Thank you, Senator Hill.
Thank you.
File item number 7, SB 467.
Very good. Thank you, Madam Chair. Perfect. SB 467 is another sunset bill which deals with the Department of Consumer Affairs, the Attorney General's Office, the Accountancy Board, and the Contractor State License Board. The measure will require the department to receive approval of the legislature to levy any pro rata charges on any of the licensing boards for administrative expenses. It will require the Attorney General's Office to submit specified reports and information to the legislature regarding disciplinary cases referred to their office. And it will require the director of the department to implement complaint prioritization guidelines for boards to utilize in prioritizing their respective complaints and investigations. In terms of the Accountancy Board, the bill will extend the sunset date to 2020 and also allow the board to place certain practice restrictions on an accountant based on disciplinary action taken against them by the board. In terms of the Contractors State License Board, it will extend the sunset date to 2020 and make some minor changes to the board's operations. I have witnesses. Support.
Thank you so much. It looks like these boards are both doing a superior job. Congratulations. In support.
Catherine Kay, California Board of Accountancy, in support of the bill, and we respectfully request your aye vote.
Thank you.
Laura Zuniga with the Contractor State License Board. We're in support of the provisions impacting our board. We would appreciate your support. Thank you.
Thank you so much. Others in support.
The California Landscape Contractors Association in support of SB 467 and specifically the provisions relating to the Contractor State License Board. Thank you.
Thank you. Anyone else in support? Anyone in opposition or with a comment? Seeing none, we'll see if anyone on the committee. This is a great example of boards that get their sunset extended to 2020, doing a great job. You are commended by all of us because we know you're got everything under control, and your licensees are very happy, not showing up here in hordes. Great. All right. Well, do we have a quorum now? Okay. Let's take roll, and we'll go ahead and move this measure.
Thank you very much. Thank you.
Bonilla.
Here.
Jones.
Here.
Baker. Here. Bloom. Here. Campos. Chang. Dodd. Here. Eggman. Here. Gatto. Holden. Mullen. Ting. Wilk.
Present.
Wood.
Here.
We have a quorum. Can I get a motion on? Thank you. And this is a due pass to appropriations on SB 457. Take the roll.
Bonilla.
Aye.
Bonilla, aye. Jones.
Aye.
Jones, aye. Baker. Aye. Baker, aye. Bloom.
Aye.
Bloom, aye. Campos. Chang. Dodd.
Aye.
Dodd, aye. Eggman. Aye. Eggman, aye. Gatto. Holden. Mullen. Ting. Wilk.
Yes.
Wilk, aye. Wood.
Aye.
Wood, aye. 8-0. Measures out.
Okay, that was 8-0 on SB 467. I said the wrong number.
Okay.
And well, let's go and take up file item 3, SB 396. If we could have a motion and a second. Due pass to appropriations.
Bonilla.
Aye.
Bonilla, aye. Jones. Aye. Jones, aye. Baker. Aye. Baker, aye. Bloom.
Aye.
Bloom, aye. Campos. Chang. Dodd.
Aye.
Dodd, aye. Eggman. Eggman, aye. Gatto. Holden. Mullen. Ting. Wilk.
Aye.
Wilk, aye. Wood. Wood, aye. 8-0. Measures out.
8-0, the measure's out. And then we have consent. If I could get a motion on file items 15 and 16, SB 799, SB 800. Consent calendar.
So moved.
Thank you.
Bonilla.
Aye.
Bonilla, aye. Jones.
Third one's
Jones, aye. Baker.
Now,
Baker, aye. Bloom.
Aye.
Bloom, aye. Campos. Chang. Dodd.
True.
Dodd, aye. Eggman. Eggman. Eggman, aye. Gatto. Holden. Mullen. Ting. Wilk. Wilk, aye. Wood. Wood, aye.
Consent calendar is out. Thank you. File item number 8, SB 468.
Very good. Thank you, Madam Chair. SB 468 is the Bureau of Security and Investigative Services Sunset Bill. This bill will extend the operation of the Bureau for 4 years and will also make the Bureau subject to review by the appropriate policy committees of the legislature again in 4 years. SB 468 will require employers to report incidents involving the discharge of a firearm to the Bureau. The bill will also require armed guard licensees to provide the Bureau a form signed by a licensed mental health professional before receiving a renewing of a Bureau-issued firearms permit. This will be a new reform to provide the Bureau with the most significant direction to protect consumers. It is an important update to the licensing of armed guards, the first in many years that will accommodate the current landscape surrounding armed guards throughout the nation and ensure greater public security. Lastly, this bill will make technical and clarifying changes on other licensees overseen by the Bureau, including updating the cite and fine structures for many license categories the Bureau is tasked with overseeing. There are also policy issues raised in the analysis that we will be working on and looking to resolve. So thank you for that. Respectfully ask for an aye vote, members. Thank you.
Thank you. Those in support? Those in opposition?
Madam Chair and members, Kelly Jensen representing CalSAGA, the Security Guard Association. We are in the middle, still working with the author and the chairman on this important bill. The security guard industry, as you know, has taken great pride over the last 5 or 6 years in updating their requirements and including background checks and training requirements. This bill is an interesting one, and I'm happy to report that the association is open to the concept of psychological exams for firearms. We're just concerned about some of the implementation issues and think we can work through those with the chairman and the author of the bill. Most notably are how to deal with renewals. We have 43,000 applicants out there that are currently armed guards, and we want to make sure that we can get those people and have them continue in the workforce. We also are concerned of what happens to an individual who is currently an armed guard but fails the exam. The companies are concerned about liability of having to terminate that employment and what happens to that individual after the test. These are subjective tests and want to make sure they are appropriate for the population we're looking at. But we have great hope that we can continue working with the chairman and his office. Have been very open to our dialogue, and we think we can get there. So at this point, we are still have concerns, but working in the right direction.
Thank you. Others in opposition?
Joe Collins. I represent the California Association of Licensed Repossessors. At this time, that we're going to have to take an opposed position on this, and we look forward to working with the author and anybody that will talk to us to come up with a few remedies for issues that we see. One of the big issues we have here is in the repossession industry, we have a lot of guys been around for 25, 30 years, and they don't have tow trucks. So they take cars by hand. They get in there, they program a key, and they drive it away. Well, the fine for using collateral is now going to be $250 for the first fine, for the first violation, and $1,000 for the second. So we were looking for some type of language that said repossessing by hand is not considered using the collateral, because in the past the Bureau was taking the position that if you're driving a car, you're using it. So now a guy that makes $100, $120 a car is going to be fined his second violation $1,000. We also had a few other issues. For instance, an alarm response technician or guard, if they respond to an alarm and he's under the influence, he's drunk, alcohol, drugs, provokes a shooting and shoots somebody, his fine is $1,000. But his suspension for a firearm will also last a year. A security guard does the same thing. He doesn't really have a suspension. But if a repossessor bumps somebody or pushes somebody at the scene of a repossession, that's $2,500. So, and that's likely to happen a lot, even though it's not intentional. Assault or battery would be just touching somebody, and you're looking at a $2,500 fine. We would just like to have a sit down and talk to a decision maker here, somebody we could work with, just to fix just a few of these. For instance, if you're a repossession agency and you do not report that your corporate officers have changed, the fine is $150 for the first violation and $1,000 for every violation after that. So if there's 3 people you didn't report on within 30 days, that's a $2,150 fine. But If a security guard does that, it's only $500 per violation. And there's other inconsistencies in the Act, and we just want it to be consistent and fair and reasonable. The repossession industry is comprised of small businesses. So although the fines at $25 and $100 look like they might be a lot, by the time the Bureau finishes stacking $50 here, $75 there, $250 here, it comes out to thousands of dollars. So we would just like the opportunity to sit down with the decision maker to work this out.
Thank you very much. Others in opposition? Seeing none, questions from the committee. Ms. Baker.
Thank you. And Senator, I'm very pleased to hear how cooperative the discussions are with respect to amendments and that there's progress being made. And for that reason, I will be a yes vote today. Certainly going to watch very carefully what it looks like if it's able to come to the floor. And wonder if you can respond to some of the questions that were raised by the repossessors.
Thank you, Ms. Baker. Yes, the citation and fine schedule has not increased in 20 years. Right now, the amount failure to carry a Bureau registration card amounts to a $10 fine. Failure to carry a firearms qualification card is a $25 fine. So the fines have been increased. No one's changing the description of the violation or the criteria for violating. But this is just increasing the amount of the fine that hasn't gone up in 20 years, and we're basing it on what the Bureau is looking for and what they need. But I think the gentleman raised some points that I think are important, that we need to really sit down and make sure there's a good understanding of what the amounts are and what they're going up, and that they're not going up in an amount that is, is unfair and unjust. But, if you're violating the law, if you violated it today with the current fine schedule, you'll violate it in the future with the new fine schedule. So if you're not violating today, you won't be violating then. So we haven't changed the criteria for that. But if the fine amount, I think we need to look at that, and I think he raised some good points, and we'd be happy to do that and sit down with him. Absolutely.
Thank you. It certainly sounds like the possibility for inconsistencies may be one that hopefully you're open to considering. It sounds like valid points that have been raised. Well, thank you. I again, will be voting yes today. We'll just be watching it carefully as it comes to the floor, and I hope that it'll have worked out as much as you can. Thank you for working cooperatively with them.
Yeah, and just to respond to Mr. Jensen's concerns, and it is an issue because we're going into kind of uncharted territory in California by requiring a mental health evaluation before you issue that permit to carry the weapon, and especially with the 40,000 that currently have licenses, how you handle the renewals. We've added some language in here to make it clear that unless there's evidence that a licensee has fired a weapon or had some violations or some concerns, you would not really retest them. They're grandfathered in. But we want to make sure that there's a vehicle in place to make that happen and allow it to happen. So we'll be definitely working with them on it. So thank you.
Thank you. I don't see any other questions. Do you want to just reconfirm you're taking the committee amendments?
Yes, taking the committee's amendments. Yes, absolutely. Thank you.
And I think did we have a motion and a second on this? And this is a do pass as amended to appropriations. So we do have a motion and a second. We'll take the roll.
Bonilla?
Aye.
Bonilla, aye. Jones?
No.
Jones, no. Baker?
Aye.
Baker, aye. Bloom? Bloom, aye. Campos? Chang? Chang, no. Dodd? Dodd, aye. Eggman? Eggman, aye. Gatto? Holden? Mullen? Ting? Ting, aye. Wilk?
No.
Wilk, no. Wood?
Yes.
Wood, aye.
7-3. We'll leave the measure on call.
Thank you, Madam Chair.
Thank you. Let's move
Thank you,
on
members.
to item 9, SB 469, State Athletic Commission.
Very good. Thank you. SB 469 extends the operation of the California State Athletic Commission for 4 years.
Move the bill. Second.
Thank you, Mr. Chair. This bill is important, necessary, and changes federal law, and we appreciate your vote. This is Andy Foster, the executive director of the commission, who's here and is doing such an outstanding job. That's why this is such a good-looking bill today. So thank you.
Great. Mr. Foster, would you like to add something to the testimony in support of this?
The commission supports our extension.
We just wanted to hear the accent.
Been around long enough to know how it works.
Others in support? Oh, Mr. Jones. Well, anyone in
I can wait till
opposition?
I'm sorry,
Yeah.
I'm jumping in before testimony.
Okay.
I can wait till you're done running through testimony.
Oh, I think they are done.
Okay.
Anyone else in support? Any opposition? Seeing none, Mr. Jones.
I just want to thank Mr. Foster for coming this morning. When he took over this commission a couple of years ago, it was in great disarray, and you've done a good job of putting it back together, and look forward to your continued success. Thank you.
It's very true. Thank you. And we have a motion and a second. We'll take the vote. And this is a do pass as amended. I think there's only one amendment.
Absolutely.
Bonilla.
Aye.
Bonilla, aye. Jones.
Aye.
Jones, aye. Baker. Baker, aye. Bloom. Bloom, aye. Campos. Chang. Chang, aye. Dodd. Dodd, aye. Eggman. Eggman, aye. Gatto. Holden. Mullen. Ting. Ting, aye. Welk. Welk, aye. Wood. Wood, aye.
10-0, measures out.
Good. Thank you very much. Appreciate
Thank
that.
you.
Thanks.
Item number 13, SB 671, pharmacy, biologic products. This would be a due pass to health.
Very good. Thank you, Madam Chair. SB 671 allows lower cost biosimilar drugs to be automatically substituted by a pharmacist. It also requires that the pharmacist communicate with the physician about the substitution within 5 days after the prescription is filled. Since the majority of healthcare providers are using electronic medical records, the communication will be as easy as a click of a button. Recent amendments have removed the opposition of several groups including Walgreens, CVS, pharmacists, and retailers. This bill is critical so pharmacists can more easily provide lower-cost drugs to patients and so doctors can have access to complete medical records for their patients. I have a witness in support.
In support.
Morning, Madam Chair, members of the committee. My name is Jeff Ike. I'm an executive director at Amgen and in our biosimilar business unit. Amgen, as you know, has been a pioneer in the biotechnology industry for the last 35 years. What you may not know is that we're also a leading developer of biosimilar medicines with over a $1 billion investment in these medicines to be manufactured in California for patients here and around the world. Biosimilars are medicines that are similar to existing biotech medicines and are designed to increase access and lower cost of biotech medicines across the board. What I'd like to do is really just give you a quick overview of why we support, as a biosimilar developer, SB 671. First and foremost, the FDA will determine that medicines are approvable as biosimilars or interchangeable medicines, but stop short of telling states how those medicines will be dispensed in pharmacy, because that's the purview of the state in the legislature and the pharmacy board. So this is a really important bill to determine how California will use these new medicines as they're approved by FDA. SB 671 strikes an important compromise between increasing patients' access to these medicines while at the same time ensuring that there are provisions to hold manufacturers like us accountable for the quality of the medicines that we provide to patients. And that accountability comes through accurate and complete patient medication history that is available to all members of a patient's healthcare team, including pharmacists, patients, and providers. We think this is a fundamentally important bill because it will hold manufacturers accountable individually for the quality of their product, and in doing so is going to instill a significant amount of confidence among patients and providers that are struggling with grievous disease where they're already using biologic medicines to be able to feel comfortable prescribing a biosimilar and interchangeable medicine knowing that those records are complete. So I would urge your aye vote and support 671.
Thank you. Others in support?
Good morning, Madam Chair and committee members. Missy Johnson with Nielsen Merckxemer here on behalf of Johnson & Johnson in strong support.
Thank you, Madam Chair. David Gonzalez on behalf of the California Life Science Association, representing over 750 entities in the life science sector. I have to be here in support.
Madam Chair, members, Autumn Ogden with American Cancer Society, Cancer Action Network, and we're here in support. Thank you.
Good morning, Kristen Harrow, Arthritis Foundation in support.
Fred Main on behalf of the Generic Pharmaceuticals Association in support.
Jennifer Snyder on behalf of the Biotechnology Industry Organization in support.
Jimmy Jackson, Biocom, in support.
Aaron Norbert on behalf of Boehringer Ingelheim, also in support. Thank you.
Allison Barnett on behalf of Novartis Pharmaceuticals, also in support.
Natalie Cardenas with UCB, in support.
Alex Hawthorne on behalf of Bristol Myers Squibb, in support.
Shane Gussman on behalf of Express Scripts, in support.
Jim Gross on behalf of Genentech, Novo Nordisk, and Merck, in support.
Cassie Gilson on behalf of Hespera, in support.
Chris Rosa on behalf of the Pharmaceutical Researchers and Manufacturers of America, as well as the cancer treating physicians, the oncologists, the Medical Oncology Association of Southern California, in support.
In opposition? We're ruining the mood.
Madam Chair, we're actually we are neutral on the bill. Brian Warren with the California Pharmacists Association. We had previously had an opposed unless amended position. We'd like to thank the author for working with us and the chair and her staff for helping negotiate some amendments that were able to remove our opposition.
That's great. Family Thanksgiving dinner is back on.
Peter Kellis on behalf of Walgreens want to thank the author, sponsors, and everybody who's been involved with this issue for resolving the differences between the multiple sides. We're neutral on the bill.
Good morning. Angie Minetti with the California Retailers Association. I want to thank Senator Hill and the committee, Madam Chair, and all stakeholders for working together to resolve our remaining issues, which the recent amendments do address. So thank you. We are neutral.
Madam Chair and members of the committee, Tom Bone on behalf of CVS Health, just want to confirm that we too have removed our opposition as a result of the most recent amendments, and we appreciate the work of the author and everyone else. It's been a long 2 years.
John Caldwell on behalf of Pharmaceutical Care Management Association. We've also removed our opposition.
Madam Chair and members, Thanksgiving dinner is back off.
You're just not invited.
Yeah.
What a surprise.
50-1. I like these odds. Nick Luizos on behalf of the California Association of Health Plans. And while we do appreciate the work that went into the amendments that the author accepted, for the health plans, the issue of notification was never an operational or practical issue. It was a matter of policy. And we agree with the FDA commissioner and the tenets of federal law that, in our view, state that substitution can occur in this area without any barrier or notice of this type. So, a cleaner bill would be something that we could support and that could truly capture the savings of biosimilars and their promise. So for those reasons, we oppose. We continue our opposition. Thank you.
Thank you. All right. Seeing no one else in opposition, any questions from the committee? Ms. Eggman.
I'd just like to say thank you, Senator Hill. I was on this committee when we heard this, or almost heard this the first time. And so thank you for all your work on this, and I'm glad to move the bill.
Thank you very much.
And we do have a motion and a second. Any other comments? Questions? Thank you. This is a due pass to health.
Bonilla.
We're going to get to hear it again. Aye.
Bonilla, aye. Jones.
Aye.
Jones, aye. Baker. Aye. Baker, aye. Bloom. Aye. Bloom, aye. Campos. Chang. Aye. Chang, aye. Dodd. Aye. Dodd, aye. Eggman. Aye. Eggman, aye. Gatto. Aye. Gatto, aye. Holden. Mullen. Ting. Aye. Ting, aye. Wilk.
Yes.
Wilk, aye. Wood. Aye. Wood, aye.
11-0. The measure's out.
Thank you so much, Madam Chair, for all your help, and thank you, members, very much.
Thank you.